My name's Hilary Garrett. I'm a public advisor with North West Coast. I'm theme co-lead for the Equitable Place-based health and care theme. And I do quite a bit of reviewing and, well, all the things public advisors do, looking at bids and joining in projects and so on. Okay, well, I guess it's, well, part of it's because I'm a nosy old woman and I like to know things. But also, I'd been involved in a couple of projects where health economics were quite central to what we were looking at, particularly around virtual wards, for example. And I didn't have a clue really about what any of it is about. I have a filter as a public advisor. I know I'm not a researcher, I'm not an academic, I just filter out. But it's nice to have some basic understanding. And I thought, well, maybe this is the place. So that's what. Right. So in terms of accessibility, definitely, it was really easy to follow. Everything was put forward in a clear way. I would certainly, I can't speak for anybody else, but I was made to feel that no question was silly, and that if I didn't understand, I could come back and ask. And so it was really supportive as well. And I felt that it gave me some useful tools when I'm looking at, so for example, grant bids or working on a project. So I've got a dippy old lady brain memory, so I don't retain facts very well. So if you were to give me a test on it, it wouldn't be there. But when I'm reading about things, or I'm in a meeting and people are talking about it, I don't anymore feel like they're talking a foreign language when they talk health ec. Right, in terms of the health economics bits, I think it was understanding the processes and the methods used, just basics, and the language used as well. Like demystifying, I guess, a lot of the terms. So that was really useful for me. And it just gave me that nice overview. The other thing as well that I found really useful was the introduction to PubMed, because I didn't know anything about it, not used it. It made me think, actually, we should be doing some training in that for public advisors, full stop. But so I've used it quite a lot since as well. There was the YEC, I can't remember what it stands for. That York thing. I mean, it's like they give a glossary of health economic terms. Brilliant tool. Help me. I guess I wouldn't say it makes me feel confident, but I don't feel like I'm on the back foot anymore. So that when people are discussing it, I do feel that I can join in, which is a big step forward for me. Yes, definitely. It's definitely done that. So although I'm not confident about all the details of it, I do feel, and on projects that I'm involved with now, and I'm reading the stuff, I've got a much better understanding of what they're talking about. So yeah, I guess in a sense it has, and it makes. I mean, I feel like I understand what they do, which is is a step forward. But it's a two-way street as well. So I'm hoping that goes both ways, so that the health economics researchers feel that too.